Good health is a vital component of our well-being. Human society and the media often portray the health field through isolated medical cases focused on treatment. What most people don't realize, though, is that a lot of behind-the-scenes work occurs to prevent illness and injury in the first place. Public health is the component of health focused on this prevention aspect of health. To use an analogy, medicine is focused on saving individuals one by one who fall off a cliff. Public health, conversely, is the fence constructed before the edge of the cliff that prevents people from falling in the first place. Public health saves millions of people all at once, but its essential role is not well understood. Take a journey with me into the heart of one Alaskan borough to understand the true value of public health and public health nursing in one Alaskan community. Many people don't know much about public health and public health nursing. Come with me to begin our journey as we learn from experts in the Mat-Su Borough as they explain the importance of public health and public health nursing in the community.
That public health services are really a public good.
It protects everybody. So you see, in that way, public health is a public good. Even if you don't benefit from it directly as receiving an individual service, you benefit from it indirectly because you're protected because somebody else got protected.
But the purpose of public health is to promote wellness, prevent disease and illness, and protect populations.
Oh, public health is sort of the organization that you don't see and don't know about, and they're the ones that do all the background work to make sure that the population doesn't have these illnesses that spread.
That when public health works really well, you don't even know that we're here. So,
public health to me is providing education and services to community members.
I think the best part of being a public health nurse is you're not just doing individual patient care. You're not just focusing on one person. You have the opportunity to work with the whole population and make a change with everyone and not just one individual.
Individual, community, and systems. All three parts are public health nursing, and that's what's different between us and, let's just say, your average doctor's office or even your average federally qualified community health center.
And at a systems level, we really try and make sure that we can advocate for policies that keep the community healthy.
you know, we do all kinds of education from substance use, what substance abuse looks like, what resources there are in the community.
We do tuberculosis screening, and then if there's needed to be treatment, then we provide that as well. We do immunizations for children. We do well child visits, newborn hearing screens. That's just a few of the things that we do here in the office.
I also do education about healthy lifestyles, you know, weight to height ratio, BMI, what a serving of vegetables looks like, where to get food for people that are food insecure.
Well, we provide individual care, but that's not all we do. The individual care is sort of the safety net for people who need services that they either can't access somewhere else or for reasons of confidentiality they don't want to access somewhere else. And those services are directly related to the greater population. So we do immunizations, and we're not just immunizing the individual. When we immunize one person, we protect people around them that can't be immunized. Reproductive health services to help prevent unintended pregnancies and STDs.
And every time someone comes in, we give them a lot of education that they can understand what's going on and take with them that they don't have a chance to get other places.
We have a lot of connections with our community partners, and that could be professional ones such as other physicians' offices of all stripe. as well as community programs like the Rotary, the Kiwanis. We bring educational resources and out to the community in our K-12 system, our post-secondary institutions. We go and speak at community functions. We really bring a lot of educational outreach to wherever and whenever.
That if we did have a crisis here in Alaska, a big earthquake or some kind of emergency where we were needing to distribute medications, vaccines, water, food, that public health nurses are here to help facilitate those points of distribution.
Well, like we do disease investigations for all kinds of reportable diseases, anywhere from STDs to foodborne illnesses.
Our job is silent but also noisy when something happens. And you may not hear about us until we have to address an issue that is very scary.
People may think that health is solely determined by biology and pathogens that invade the body. Research indicates, though, that there are many other factors that influence health. Let's see what the public health nurses teach us about additional elements that influence health.
Health is influenced by diet, is influenced by your lack of activity, lack of exercise, by stress, by pollution, by destructive habits. It's just a whole lot of things that health is actually affected by.
You know, we talk in public health nursing about social determinants of health, and that's a real broad concept.
The determinants of health, there's at least 21 that have been identified. Poverty, pollution, poor building, poor housing, water and sanitation.
It includes where you live. It includes how you live. It includes, your social support systems. It includes, obviously, economics. It also includes, your experiences as a child.
Where you were born, how you were born, the amount of money you have really determines the opportunities, not only everyday life, but how healthy you are.
The emphasis that public health places on addressing the social and ecological determinants of health has great public and financial benefits. Public health nurses and community members shared with me some of the most valuable benefits of public health in the Matsu community.
Generally speaking, again, because public health is a public good, the health of the community is improved by the existence of public health nurses.
Public health is super important to our community. So we actually said some of our patients can't always afford to come to our clinics or clinics in the valley, and so we always refer them to public health. A lot of our teenagers that need to go there without, that need extra help, we also see that don't want to come to us.
The work we do is all about prevention, and so public health has a key part in that work as well, because we all know that if kids aren't healthy, if they're not well fed, if their nutrition is lacking, they don't have their immunizations, then they're not going to be as successful as they otherwise could have. So all those prevention efforts are so important, and we all have to work together to carry different pieces of that.
But if we do our job correctly, we don't have a measles outbreak. We don't have tuberculosis in raging numbers. We lower the rates of sexually transmitted infections. We don't have as much domestic abuse or as much family violence.
Because the public health is in everything and it does everything for the community, and so there's just a lot of gaps that need to be filled, and if public health wasn't there, those gaps would be, there'd be nothing for them. So
it's very important to have the benefits for our youth, and the birth control, the STD testing. It's nice for them to get the materials that they need to learn about those things.
Well, I think that public health is definitely very important in the community. It helps get the message out. As a dietitian, we're primarily focused on nutrition, healthy eating habits, but also physical activity, smoking cessation, and overall good mental health as well is very important, and it all plays a part in the big picture.
Public health is a necessary organization in our community.
I would say that many of the problems that we have today are probably in hindsight because we didn't pay enough attention to things a generation ago.
Because we're talking in our government about illness and sickness and everything about the healthcare industry and insurance, and we're not talking so much about preventative care, and I believe public health is about preventative care, and so we need more of that.
I think without public health, it would be hard to make an impact in a positive way.
It benefits our community by providing education and needed resources.
People that can't afford or don't have some health care that public health offices around the country can help provide that care.
I think the benefits of public health in the community are is the access that young women have, or men, that they don't have to hesitate. They can just call. The service is there, it's provided, and it's simple. It's not difficult to get services there.
One of the benefits is providing people with education and with services that they would not be able to receive in other places.
That helps our society stay at a certain standard so that everyone has their basic needs met.
We collaborate a lot on immunizations and trying to increase the immunization rates in our community with public health.
I think it's probably a good idea to have them. I really do. I mean, if there's diseases that can be prevented, then we should definitely do what we can to prevent them.
These are really important services in the Valley.
Seeing the light come on in some of our clients when you're giving them information that they don't have, and that information is empowering them in how to protect themselves and how to take care of themselves.
We appreciate the partnership that we have with public health and couldn't do the work we do without them.
Public health is a public good like clean air and clean water and police protection. Sometimes it's difficult to realize the financial benefits because, as I once had a county commissioner tell me, he said, "Jerry, I spend all this money on public health." Now, I didn't really spend all that money on public health, but that's what he said. "We spend all this money on public health and then nothing happens." And I said, "Thank you." And he looked at me for a minute, and it dawned on him, oh, if you do your job, nothing's supposed to happen. Bingo.
Public health is a cornerstone for any good, healthy, prospering community. You have to have public health. It's otherwise people leave town. You have to have public health.
Patients at the Public Health Center also recognize the benefits and value that public health services provide them. Follow me to learn why patients choose to get health services at the Mat-Su Public Health Center and the value of public health in their lives and community.
I know when I was 15, I was homeless and I didn't have any medical insurance or anything like that, and I went and got birth control. It costed $0, so that was really great, and it prevented me from having any more challenges. And they also provided free STD testing, so that's a very important piece in our community.
Well, I came here because most of the clinics out there, even if you have Medicaid, will charge you for TB tests. I just so happen to have been offered a job I have to have a TB test for. So I can come here and get it at no charge, therefore I can afford to take the job because I need that money for my gas tank. So stuff like that's really awesome.
I just chose this place because I heard it was highly recommended and really helpful.
I think because it's so small, the nurses get to know people much more deeply than a regular hospital or clinic.
I've come here multiple times. I came here when I got pregnant with my first daughter, and they've always been helpful and nice, and it's just a good thing for women who need healthcare to have.
I myself lived in a tent on the streets last year, so just this place helped me to get back on my feet, and that's really necessary for a lot of people to build a good society.
Well, my sister came here back when she first got birth control, and she had a good experience, so I figured why change? Why pick a different one? So my mom likes this place.
Personally, I have a sister that uses services like that. There are people that need those services, that it should be affordable to not have to wait until it becomes a bigger problem and becomes unattainable for somebody to be able to fix that problem.
A lot of the people that really need the health insurance and they can't get it, like they can go there, they get their immunizations.
Well, we've used public health for vaccinations for our kids.
It helps people accept jobs and be able to start a job sooner because they have the money to get the testing they need. It also provides, whether it be counseling, someone to talk to.
I think it's handy. I think the easy access to birth control is important. Like, probably the most important thing, like, in my life right now. And I think that this place was easy to get to and welcoming, and I like that it's kind of all women here, so it's a good environment for people that might feel, concerned about getting on birth control. I think that it's a good clinic because they have, first off, they have the sliding fee scale, so younger people, I was 18 and I had my daughter, and it was really beneficial to be able to have the proof of pregnancy and everything done through them for the less expensive costs than most other places.
That they're always there. They're always present. They always, their partnership is, I can always rely on it. I don't have to question it. It was available for me.
When I was working with families who have children with developmental delays, oftentimes there were public health nurses that would make weekly or monthly visits there to make sure things were all right and to help answer questions or teach families good health practices in their homes.
I think it helps families in need, anyone struggling. It helps them get the services that they need for them and their family.
It's important to have it here. It's important that people have access to this kind of a thing, just so that they can have more control over their own lives, without having to worry so much. Always just been helpful to other people I know that come here.
It's a great service.
Without a good public health, the community tends to, for lack of a better term, falter. There becomes more drug addiction. I think it has a lot to do with crime too.
To have a stable society, you need to have healthy people.
So a lot of the families really depend on it for their children because there's a lot of kids
even
here.
teenagers now.
Yeah,
They struggle a lot.
Because a lot of the teenagers they've been kicked out of their houses and they don't know what to do.
Public health is essential for. It's something that really it's important for everyone. It's important for everybody to be not just physically well, but mentally well too.
As we have learned so far, public health and public health nursing helps to improve the health of the community. If the services that public health and public health nursing provides were taken away, how would that impact the Mat-Su community and the rest of Alaska?
I think it already is. They've done some cutbacks as it is, so I know that the ages have changed. Some of our patients haven't been able to get in there that have called birth control, those kinds of things. It's a huge need about.
If they have access to condoms, birth control, STD screenings or treatments, a lot of people can't afford it.
We could have increase in pregnancies, increase in STDs, which we're always trying to get a hold on that.
Same thing with reproductive services for females. They wouldn't be able to get birth control or have birth control options or pregnancy screens and things like that. So we would see a rise in teen pregnancy and teen STDs.
Again, a society should be judged by how we treat those that are the most vulnerable, and I think that's what you would see. And you wouldn't always hear about it. It might be 5-10 years down the line before you would see the repercussions of that. It's pretty tragic.
It would be
more of a slow implosion than an instant recognition that we were gone.
In the short run, losing public health nursing will probably lower immunization rates, so we'll have less protection in our communities. It will probably raise, even in the short term, some of the rates of the spread of communicable disease.
We would see a severe increase in active tuberculosis.
You know, if we were not here to do some of the investigations that the section of epidemiology gives to us, we might see an increase or a spread in some of the foodborne illnesses.
People would not have the resources that they need. We get many, many phone calls on a daily basis here, and I don't believe that the providers who give direct patient care to their clients would have the time to screen as many calls as we do on a regular basis.
If you got rid of us, you'd get rid of the safety network that protects the whole group of people living within one community or all the communities within our borough.
Educational outreach would not be there, so people would not be going into the schools or the colleges or reaching out to community members who have questions about different health aspects, and so that would all be lost.
And without that, our society would, I feel, crumble.
The value of public health in Mat-Su is indispensable. Now we hear just how valuable public health is to community members. For these represented voices in Mat-Su, public health is
important.
Community.
Beneficial. And I don't think Alaska has enough of it.
Necessary.
Effective.
Essential.
Everybody's responsibility.
A band of angels fighting off the evils of the world.
Helpful.
Very important for our community.
Public health is the community coming together to form happy and healthy families.
It's prevention, which is the cheapest and most effective form of health care.
It's one of the ways you judge what kind of a community you live in. So it's one of the building blocks.
Amazing. Helpful.
It keeps us healthy at an affordable cost.
Being there for our youth.
Public health is good and saves lives.
Public health is educating our community and providing services to those that are uninsured or underinsured.
Education and to educate folks to access of care as well.
Public health is the best policy for all people.
Essential to the health of the population and to the well-being of a community.
Valuable to our community. It's needed.
Public health is about education and quality of life and ability to be able to stay healthy.
Public health is offering the best chances for everyone equally to live a healthy life.
Public health promotes good health and empowerment for the communities it serves.
Public health is vital to life.
We're here for the community.
Public health is something we can't do without. It's a necessity.
It's an asset to our community.
It's essential to having healthy communities.
It's one of the cornerstones of our society.
A public good that should be continued, maintained, and cherished, not only by the people, but by the legislature that is responsible for our budgeting, and that we should remain faithful to the state constitution of which public health is part.
As Alaska faces financial setbacks, the state is left in a quandary as to which public services may be dissolved or potentially privatized, leaving the future of public health and the communities it serves in a state of flux. It is imperative that community members and decision makers in Alaska understand the extent of public health and its cherished